Perimenopause is a kind of a symptomatic time that occurs before menopause. It's usually a result of hormonal changes, and it can lead to a lot of the symptoms that you hear women talk about on a regular basis. So your cycles can be shortened. They can become heavier during that time. Some women experience mood swings, weight gain, hot flashes, and that eventually leads into menopause. And by definition, you are not in menopause until you have not had a cycle for 12 full months. Your cycles can kind of come and go for several years. And sometimes you may skip 3, 4, 5 months at a time and then suddenly have a cycle. So if that happens, you're not in menopause yet. Perimenopause and menopause are not disease states. We sometimes treat them like they are, and they can make you feel very bad, but in this country, on average, most women are fully in menopause by age 51 to 51 and a half. When I have patients come in that are really symptomatic, whether they're experiencing mood swings, hot flashes, sometimes joint pain and stiffness, if they're still in the perimenopausal phase, so still having cycles, we would normally regulate that by manipulating hormones, either with birth control. Sometimes antidepressants can be used for some of those symptoms, including hot flashes. And then there are various minor surgical procedures that can be done for really excessive heavy bleeding. Once somebody is menopausal, then hormonal manipulation kind of goes out the door, and we would do hormone replacement therapy if needed. The only real indication for true hormone replacement therapy would be if somebody's having menopausal symptoms that are so severe, it just really reduces their quality of life and reduces their functioning. At one point in time, we thought it reduced the risk of things like heart attacks and strokes and chronic heart disease, Alzheimer's disease, and it turns out it actually increases the risk for all of those things. Bioidentical hormones are still synthetic hormones that are made in a lab. The difference is we can tailor the dose to your symptoms and what you need. We can measure blood levels. They're compounded, usually in a compounding pharmacy, and you can change the dose up and down of estrogen, progesterone, sometimes testosterone, depending on symptoms, so that we can tailor it to what the blood work shows and what your symptoms are. Versus pharmaceutical hormones, which comes in a standard dose, and they are FDA approved. Bioidentical hormones are not FDA approved. So you don't have to use hormones to treat perimenopausal symptoms. And it kind of depends on what the symptoms are that you're having. But we can use antidepressants to treat some of the mood swings, the irritability, the anxiety. Insomnia is a big part of menopause. And believe it or not, even hot flashes can be treated with antidepressants. They're not quite as powerful and effective for hot flashes as hormones are, but they also don't come with some of the risks that hormones come with. Sometimes we use progesterone for sleep. And also there are non-addictive prescription sleep aids that can be used to help sleep that don't have any hormones in them as well. Hormone replacement therapy definitely has its benefits, and it definitely has its cons. It suppresses menopausal symptoms so that you don't struggle with those day-to-day trouble thinking, joint pain, mood swings, hot flashes, irritability. It increases quality of life a lot during menopause. But there are risks that go along with it. If you smoke cigarettes, you definitely cannot use hormone replacement therapy because it dramatically increases the risk for blood clots. It will increase your risk for breast cancer, Alzheimer's disease, heart disease. So if you're already a high-risk patient for those things, then the drawbacks would by far outweigh the benefits. So I would just want to caution any patients, if you're considering hormones, to make sure somebody's looking into your past medical history to make sure that it's safe for you to take it. And also, I would encourage patients to know that menopause is not a disease. It's just a bummer. And there is a light at the end of the tunnel. The symptoms do get better, but they take a long time to get better. And so sometimes it's something you just sort of have to struggle through and suffer through until you start to come out of it. If you feel you're struggling with the symptoms of perimenopause or menopause, come and see me at Old Family Medicine, and I can go through your options with you regarding hormone replacement therapy and non-hormone therapies to help you work through that struggle.